Question number 41. 45-year-old female, joint pain, skin rash, and pedal edema, photosensitivity. So clinically, whenever you are in the OPD, if you get these kind of history, you can make the diagnosis as systemic lupus erythematosus. But there are some condition called drug-induced lupus, where a past history is very important. This is what you encounter clinically. So in the NEET tests, you might encounter a question like this. In drug-induced lupus, which markers are least positive? Is least positive? Answer is dsDNA. dsDNA anti-double-stranded DNA positive is more in organ-specific systemic SLE, whereas it is very, very rare in drug-induced lupus, where other autoantibodies common, like Rho, histone, and ANA. Out of this also, a UG level question they might be asking which is specific for drug-induced. ANA can sometimes be positive, but is very rare as dsDNA. And one more point related to drug-induced lupus is it is usually more of cutaneous lupus rather than organ involvement. Even if organ involvement is there, unlikely the kidney will go for some kind of serious insult. So this is some points related to drug-induced lupus. The drug that you commonly write in the OPD, tamsulosin, is the alpha blocker, to be more specific, alpha 1A blocker, which doesn't form the filtration barrier. You take the blood vessel, glomerular basement membrane, then this way podocytes will be there. Here endothelium will be there. Podocytes are epithelial cells, basement membrane. So glomerular basement membrane, endothelial, podocytes forms the filtration barrier. JG cells doesn't form. Extraglomerular cell doesn't form the filtration barrier. A very simple question, UG level, physiology level question. Which is called lifeline of CKD patient, atriovenous fistula. Is called as lifeline of the CKD patient. Why it is called? Because for those patients who are undergoing maintenance hemodialysis without a stable vascular access, which can serve for multiple cannulation over a period of years, 5 years, 10 years, 15 years, there are some CKD patients who are doing fine over 10 to 20 years if that fistula is good. So AV fistula is called the lifeline of CKD patients. 56-year-old patient with the feature of nephro, which test you will select? The answer is 24-hour urinary protein. What is the explanation? First, we will look at ACR and PCR. This urinary ACR, PCR are the shortcuts for this investigation. For example, if we ask the patient to collect the urine for 24 hours in a container, the patient will be uncomfortable to collect, and who will be comfortable to collect their own urine in a container? And that too, you have to bring the patient have to bring to the hospital and submit it. It is cumbersome process. So that is why instead of doing it in a 24-hour, we have selected this shortcuts, ACR and PCR, albumin in 24-hour, protein in 24-hour. So we are not going to do shortcut. Whenever we have to come which test to select or gold standard to select whatever it is for proteinuria, we have to go for the normal, leaving out the practical difficulties. For the MCQ purpose, it is 24-hour urinary protein or albumin. Out of these two, which one to select? See, it is the protein which will be always you have to select. Yes, albumin is a very sensitive marker for the glomerular involvement, but we don't want the sensitive marker. We want overall protein, how much it is excreted. So in a pediatric patient, probably albumin might be a sensitive marker, but over a 24-hour, the normal protein is less than 150 milligram. We want to know how much protein the patient is excreting. That is why the best test here is 24-hour urinary protein. You can look at the photo over there. One limb is swollen disproportionately to other. As a final medicine resident, I hope you made the diagnosis. It is DVT. When the NEET assess, you might get the question like this. DVT most common in which of the following condition? The answer is membranous nephropathy. The nephrotic syndrome associated with membranous nephropathy prone for thrombosis. Any nephrotic syndrome is prone for thrombosis because of loss of protein C, protein as antithrombin C, this kind of anticoagulation factor which being lost in the urine, patients are at increased risk of thrombogenic state. Both thrombogenic and coagulopathy is common, but thrombogenic because of the loss of the anti-clotting factors in the urine. And this thrombogenicity is more common higher the proteinuria. When the serum albumin comes less than serum albumin, I am saying. As the protein is losing in the urine, serum albumin start coming down. The serum albumin is less than 2 gram milligram. There's a high chances of thrombosis. And that can occur with any nephrotic. It is more common with membranous. Hypokalemia seen in type 1, type 2, type 3. Type 4, there will be hyperkalemia, which is more common in diabetes patient, also called as hyporeninemic hypoaldosteronism, which is called type 4 RTA. What is free water deficit? Age is given, weight is given, patient sodium is given. Since in the case we collected the student's mobile, they might have found it difficult to calculate. So that is why we asked them to at least write down the formula. What is the formula? It's 0.5 into body weight into what is the patient sodium minus what is the target divided by the patient. Like some kind of proportionating things you have to take and make the value, which almost similar for hyponatremia also. Almost hyponatremia also 0.5 into body weight. These kind of calculation you will use. This is very important in your clinical practice rather than your entrance. You might not encounter this kind of exact value. Even if they ask, at least you should be prepared with the formula. So the answer, if you calculate grossly, approximately it will come around 3.3 liters, 2.9 liters. Depends on the target, which one you are selecting. Just whoever wrote the formula, we gave the mark. Normal size of the kidney despite CKD can be seen in the quiz we have told it is a multiple choice where more than one option can be correct. The answer is diabetes, HIV, amyloidosis, ADP, CKD. So these are all the conditions where even sarcoidosis, where kidney size might be bigger despite having a CKD. Name few side effects of this SGLT2 inhibitor. The commonly used drugs in diabetes, nephroprotection, cardiac protection, UTI, genital infection, dehydration, more dreadful complication or euglycemic ketoacidosis. Apart from that, nausea, vomiting, whatever that theory part type of things. Leaving that, these are more specific. Whenever a person develops more than 3 episodes of UTI in a particular year, better to stop these drugs. Genital infection more common in females. Dehydration can occur. Euglycemic ketoacidosis, where at a lower level of sugar value, the patient will develop acidosis. The last 10 questions, because of technical difficulty, we are putting the video as this kind of multiple episodes. Next, we will see from 51 to 60.